to switch gears a little bit and move into our lightning talks. I am excited to open up this discussion and hand it over to some excellent women who are going to be speaking with us today. The idea is that we're going to take short dives into specific projects that focus on diversity, equity, inclusion, and accessibility. And we're going to hear those case studies and be able to take a few questions afterwards. To kind of provide some overall context, I'd like to start today by playing a very brief video. We had a few snippets and quotes from some of our Society Steering Committee members on diversity, equity, inclusion, and what that means in their work specifically. So we will roll the video.
In my work at Evoke Kind and at the Society, inclusion is about ensuring that historically excluded and disenfranchised people have a seat at the table. It means ensuring that their voices are heard and that their input is actioned upon. It means sometimes for myself moving out of the way so that other people can have a seat at the table and a spot and a voice. And it also just means creating space for people to be their authentic selves each and every day.
In my work, diversity, equity, and inclusion means that we have representation. It also means that we have authentic voices at the table as we seek to improve our nation's health.
In my work, diversity, equity, and inclusion means making space for diverse identities, perspectives, and ideas, so that more people can see themselves and their experiences reflected in our communications.
In my work, diversity, equity, and inclusion means bringing together government leaders, community leaders, and most importantly, those with lived experiences together to collaborate on developing a systematic approach that improves health outcomes of those who are most in need.
In my work, DEI means that we need to shift the burden, that it's not okay to expect the people who suffer the most from racism, sexism, discrimination, lack of resources, to also shoulder the majority of the burden to fix it. The work lies on us.